Hi everyone, today we are doing some trigger point therapy for my patient here. So we already went through and did a full assessment, so traps and up, but for this video we will just be focusing on the trapezius muscles. So we already did the full assessment, but right before I go ahead and inject, I'm palpating again and just making sure that the patient, that's the correct location for that patient's specific pain. So now once I assessed, I'm going in and starting my needling. So here I have a 25 gauge needle and I have lidocaine, just 1% plain lidocaine, as well as 15 units of toxin for the specific treatment point in my syringe. So here I am going in and I'm pinching up and isolating that muscle, and I am going back and forth until I feel that knot start to break apart. If you find a trigger point, it's going to feel like you're going through a styrofoam cup. You will literally feel these little pops and some pressure against your needle, and I'm just going until that is completely smooth. These little knots are what are causing the pain and causing that referred pain. So our goal is just to break that up as much as possible mechanically with that needle, and then placing that toxin as well is going to help give longevity to the treatment. The lidocaine will give relief for an hour or two. It's really just for that initial treatment. Then the mechanical act of breaking up, that muscle fiber will last a couple of weeks, but that patient is ultimately going to go back to their way of life, whether it's their job or, working out, whatever the case may be, the body posture and the event that caused these to form to begin with. So they will come back. So going ahead and using that toxin is just going to give the patient longevity for their treatment, because this is very similar to dry needling, but we are administering medication. But like I said, I am just making sure I have that muscle isolated up, especially for a patient like her. She's more on the petite side. So I just want to make sure that I know where I am. And if you just saw that little twitch, that was her muscle. I'm kind of just reacting to me injecting and breaking apart that trigger point, which is very interesting to be able to see on a video. So I'm glad they were able to catch that. But I always am maintaining about 1/2 to 3/4 of my needle, again, especially keeping in mind the patient's size. So like I said, she is more petite, so I'm not going crazy with my needle. As long as I feel that I am within that muscle and I'm feeling that tension smooth out as I go, I am okay with my location. And if I want to move, or if I feel something a little bit further, I just go ahead and change locations. The patient is now numb because we were administering some lidocaine. So just going through and kind of palpating again, asking the patient if there's anywhere that still feels tight. So we just went down a little bit here. I couldn't quite reach with my first point, so just going ahead and doing a little bit and finishing up there.